And welcome into To Your Health. If you happened to watch the State of the Union address about a week and a half ago, you noticed when the president left the White House to go to the Capitol, which is about 6 blocks, they had an entourage, and in that entourage was a couple of ambulances. And of course, there were medical people too. That's the epitome of having great health care, to be able to bring your own doctor along with you. Sadly to say, for most Americans, there's a little bit of disparity there. And we have with us today Dr. Lambiase. You are the Dean of the Montgomery campus of the University of Alabama Hersink School of Medicine.
That's a mouthful, but that's right.
They put it on a business card for you too.
That's right.
And of course, last year you had your premier first health conference, and it was very well attended and a very great conference. And this year you're looking at health disparities. So give our viewers a little bit of a peek under the tent, if you will.
Well, thanks, Jack. I appreciate it, and I'm thankful to be here. So we have an annual event now in Montgomery called the Montgomery Health Policy Conference, where we bring some of the leading minds in the country to come and talk to us about issues affecting all of us in our health. So this year we're going to focus on health disparities. So why do some Americans have better outcomes in their health than others? So you can live 5 miles away from somebody and have really much different results in terms of heart attacks and strokes and diabetes. And the real question is, why is that? You would like to think in a country as rich and as great as ours that we would all be able to, everybody, we would be able to participate. I don't think we could quite have President Biden's level of having a doctor in our hip pocket, but I'm not sure I'd want that either.
He has 5 aside.
That's right. So this year we've got actually a really great lineup. We've got 2 trauma surgeons, one local, John Mark Vermillion from Baptist South, and we also have Dr. Simmons from University of South Alabama in Mobile, talking about how there are big differences in both the incidence of trauma. So their shooting violence is much different in some of our communities versus others. And also the difference in the way that, because of the way trauma is funded in the state, some people have to travel hundreds of miles to get trauma care. Wow. And so for example, if you get injured in a wreck in Dothan, you have to come to Montgomery to get your care, and you have to, in your follow-up. So they're going to talk about that. We've got Dr. Daniel Carrion from Yale University, who works in New York and in New Haven, talking about how differences in the way people live and how they cook their food and things like that change the outcomes of respiratory illnesses.
It's kind of like place-based.
Place-based, yes. Right. He's kind of the gas stove guy.
Yeah.
So we want to hear. We want to hear what he. We want to hear what he has to say.
Definitely.
And then we've got Tom Dobbs, who's the dean of the University of Mississippi School of Public Health. Has been a long-term researcher in health disparities, is going to speak to us about drivers of health disparities. Of kind of interest, he's also trained at UAB. He's an infectious disease doctor by training. And then we have Mona Fouad, who's a UAB professor who's internationally known for talking about health disparities and how we how the effect of place and environment help things. And she's the head of Live Health Smart Alabama, where UAB is going out and trying to use all of the resources of the university and the communities to affect the drivers of health outcomes in Alabama. So they're reconstructing neighborhoods and looking at grocery and food deserts and trying to address nutrition and hypertension and those things, and really have had some remarkable results around the state. So she's going to be the keynote speaker, which is the Kennemer Lecture. So I'm looking forward to it. I think it's going to be outstanding.
Great.
Yeah.
Well, it's Thursday, April the 4th.
Right.
And it's going to be at the Renaissance downtown, where it was last year.
Right.
There's plenty of places to park. And if you want to register...
Yeah, we have a website.
We're putting the website on the screen.
Right, so click on the website. It's free to the general public.
Yes.
If you're a medical professional and you want to get continuing medical education, there's a small fee to help offset the cost of that. But other than that, it's free to the public, and I think it's going to be outstanding. We'd really like to see everybody there. There's going to be some opportunities for networking and for people to exchange ideas. We're going to have some trainees presenting some research, and we'll be able to meet and visit with each other. I just think on that date, at that time, Montgomery, Alabama is going to be the epicenter of medicine in the state and maybe the country.
Well, and you know, the interesting thing about it, Doctor, is the fact that in Alabama, especially in this area that we're showing this show right now, there's been a lot of health disparities.
Oh yeah,
Yes.
we're one of the leaders of that, and you know we have, like I said, you could live 2 miles from somebody and have completely different incident of heart attack, diabetes, and also outcomes in terms of surgery, maternal health care, and so this is something that I think as just people who care about each other and as a community, we need to think about why that is.
And basically, if you're some of our viewers, you need to let your family know you need to take care of yourself.
Absolutely.
That's by far the best thing you can do for health.
Right.
There's no disparity in taking care of yourself.
That's right.
It's just the ways you choose to do it.
That's correct.
Well, thank you for being with us. And just remember, it's April 4th. It's right around the corner. If you need some information, obviously, you can call us at 334-277-5000. We'll get you connected. Or go to the website. It has all the information along with the agenda. Starts at 8 in the morning. You get out of there by about 3 in the afternoon.
Yeah.
Roughly.
And we'll feed you lunch.
Feed you lunch and have some coffee and healthy snacks.
That's right. Healthy snacks.
Healthy
Yeah,
snacks
that's
when you
right.
get there in the morning. So we'll be right back right after this.